Welcome to the GMJ podcast, the official podcast of the Georgian Medical Journal. In this series, we present structured discussions of peer-reviewed contributions published in GMJ, examining their implications for clinical practice, medical education, and health policy. This episode reviews the article titled Modulation of Hemorrheological Parameters in Osteoarthritis Patients, following Tskaltubo, low-radon, nitrogen mineral bath balneotherapy.
It's quite a title, but the research we're unpacking today is absolutely fascinating.
It really is. So, if you experience joint pain, your first instinct is probably to blame the cartilage, right?
Definitely.
We're conditioned to picture this rusty hinge. We imagine brake pads just wearing down over time, leaving bone to grind uncomfortably against bone.
Yeah, that's the classic mechanical wear and tear model.
Exactly. But what if the fundamental problem driving that structural degradation isn't actually originating in the bones themselves? What if your joints are systematically suffocating due to, a microscopic traffic jam in your bloodstream, and the clinical solution involves submerging yourself in radioactive gas and nitrogen bubbles?
It sounds like science fiction when you put it that way.
It really does. But today, we're doing a deep dive into a 2026 prospective clinical study by researchers at Akaki Tsereteli State University, which proposes exactly that.
Yeah, and it represents a really significant departure from traditional orthopedic thinking.
Right.
We are moving away from viewing osteoarthritis strictly as this mechanical issue, and we're recontextualizing it as a profound microvascular and metabolic failure.
Right. So let's establish the conceptual framework for this shift. If a patient presents with a degraded knee joint, the mechanical damage is obvious on an X-ray.
Yes, very obvious.
So why is modern hematology suddenly so deeply invested in the blood flow surrounding that joint?
Well, it's because cartilage is largely avascular.
Meaning it doesn't have its own direct blood supply.
Exactly. It relies entirely on the surrounding tissues, like the synovial membrane, to filter nutrients and oxygen into the joint fluid.
Okay, so it's totally dependent on its neighbors.
Right. So when we look closely at osteoarthritis, we don't just see mechanical erosion, we see chronic hypoxia.
The tissue is starving for oxygen.
Literally starving, yeah. And that supply chain failing is what prevents the joint from executing routine cellular repair, which, just accelerates the degradation of the cartilage.
Now, the natural assumption there would be that the blood vessels themselves are damaged or blocked by plaque, right? Sort of like cardiovascular disease.
That is a logical assumption. But the researchers of this study focus on a completely different variable, which is the physical properties of the blood itself.
Interesting.
Yeah, they investigated hemorrheology. That's the study of how blood flows and how individual cells physically deform to navigate the vascular system.
Because they have to squeeze through those tight spaces.
Exactly. You have to picture the capillary beds feeding these joints. The vessels are so incredibly narrow that red blood cells, or erythrocytes, often have to bend and travel single file just to pass through.
Wow, single file.
Yeah. So if the physical properties of those cells change, if they become rigid or sticky, they simply cannot navigate that microvascular network.
Which transitions us perfectly into the core baseline findings of the article.
Right.
The researchers sought to measure these exact physical properties by analyzing the blood of 165 osteoarthritis patients.
Yeah.
And these were Kellgren-Lawrence stages 1 through 4, right?
Yes, representing a full spectrum of the disease severity.
Okay. And they compared them to healthy control subjects.
Exactly.
Okay.
And they applied rigorous biophysical testing to understand the structural integrity of these cells. The first primary metric they measured was ultrasonic resistance time.
What does that actually mean in a lab setting? Ultrasonic resistance time.
Well, imagine you're in the lab. They take these blood samples and subject them to high-frequency sound waves.
Okay.
This process induces cavitation.
Cavitation?
Yeah, it's essentially creating these microscopic stress bubbles that test the tensile strength of the red blood cell's lipid membrane.
So it's basically seeing how much physical stress the cell can take before it just breaks apart.
Precisely. They measured exactly how long it took for the cell to structurally fail under that acoustic stress.
And the data revealed a distinct vulnerability in the patient group, didn't it?
It did. There was an average decrease of 2.4 minutes in resistance time compared to the healthy controls.
Wow, 2.4 minutes is a lot at that microscopic scale.
It's huge. It demonstrates that the erythrocytes in an osteoarthritis patient are significantly more fragile. Their cellular membranes lack the necessary elasticity and strength.
So they are far more likely to sustain damage as they try to squeeze through those narrow capillaries feeding the joint.
Exactly.
Now, a fragile cell is obviously problematic, but the second metric they measured, electrokinetic potential, or EKP, that seems to be the true catalyst for the oxygen deprivation you mentioned earlier.
Yes, absolutely.
Because the researchers noted a decrease of 3.1 millivolts in the EKP of the osteoarthritis patients. So, what does a drop in voltage actually mean for a circulating red blood cell?
Well, every healthy red blood cell is coated in this layer of glycoproteins and sialic acid residues that generate a negative electrical charge.
Oh, okay.
It's often referred to as the zeta potential.
Hmm.
And because like charges repel, this negative charge acts as a vital repelling force. As millions of these erythrocytes circulate in close proximity, this electrical field prevents them from touching each other.
You know, it's remarkably similar to the physics of static charge balloons.
Oh, that's a great way to look at it.
Yeah, like if you take a couple of balloons, rub them against a wool sweater, and then attempt to press them together.
They push back.
Exactly. The negative static charge forces them apart. They just bounce off one another.
Right, right.
So in a healthy circulatory system, the red blood cells possess that exact same repulsive static.
Yeah.
They navigate the narrow capillaries smoothly because their electrical fields enforce the strict distance between them.
That analogy perfectly illustrates the mechanism. Now imagine what happens when you remove that static charge.
They lose the repelling force.
Exactly. The study demonstrated that osteoarthritis patients suffer a significant reduction in this electrokinetic potential. Without that electrical buffer, the physical dynamics of the blood completely change.
So if the cells are no longer actively repelling one another, what happens when millions of them try to navigate the narrow capillary beds surrounding an inflamed knee joint?
They collide. And this brings us to the third core baseline metric, which is aggregation activity.
The clumping.
Right. The researchers found a 5.4% increase in aggregation among the osteoarthritis patients. The red blood cells began adhering to one another, basically stacking together like rolls of coins.
Like a microscopic traffic jam.
Precisely. It's a phenomenon known clinically as rouleau formation, R-O-U-L-E-U-X.
Okay.
And these clustered cells, they're physically too large to pass into the microcirculation.
So they just bottleneck at the capillary entrance?
Yes. And the oxygen they're carrying never actually reaches the synovial tissue. The joint remains in a state of hypoxia, localized inflammation spirals out of control, and the structural degradation of the bone and cartilage just accelerates.
So having established this analytical argument that a loss of cellular charge and subsequent blood clumping is a major driver of the disease, we really need to turn to the intervention.
Yeah, the Tskaltubo baths.
Right. The methodology here is highly specific. It's a balneotherapy protocol utilizing the flow-through mineral baths at Tskaltubo. Patients underwent 22 to 25 sessions lasting 20 minutes each.
And crucially, the researchers emphasized that these baths were isothermal.
Meaning the water is at body temperature, right?
Exactly. The water was strictly maintained at 34 to 35 degrees Celsius.
Which is neutral human skin temperature.
Right.
That feels like a really vital structural consideration for the study.
It is, and here's why. By eliminating high temperatures, the researchers methodologically ruled out thermal vasodilation.
Right, because if a patient just sits in a traditional hot tub, the heat alone relaxes the muscles.
Yeah, and it forces the blood vessels to widen, which provides temporary relief.
But it's just the heat doing the work.
Exactly. By keeping the water isothermal, any biological changes they observed had to be the result of the physical and chemical properties of the water itself, not just temperature.
And that control allows us to isolate the variables that define the Tskaltubo waters, which are nitrogen microbubbles and low-dose radon.
Right.
Okay, this is where we must apply serious analytical scrutiny.
I agree.
Because radon is a naturally occurring radioactive gas.
Yes, it is.
It is a well-established environmental hazard. So, suggesting that a medical intervention should involve exposing a patient to radioactive nitrogen-infused water to somehow correct the electrical charge of their blood cells.
It sounds counterintuitive.
It does. It requires a rigorous mechanistic explanation. I mean, how does this actually work on a cellular level?
Well, it operates through a biological principle known as hormesis, combined with intense mechanotransduction.
Hormesis. Can you unpack that for us?
Sure. Let's address the radiation first. High doses of ionizing radiation are unquestionably destructive, tearing through DNA and cellular structures.
Right. No one is arguing that.
But in strictly controlled, very low doses, radiation acts as a mild physiological stressor.
Similar to the biological stress of weightlifting, maybe.
That's a highly accurate comparison, actually.
Because lifting heavy weights creates micro tears in muscle fibers, and the body's response to that localized damage is to rebuild the tissue stronger than it was before.
Exactly. So when the low-dose radon emits trace amounts of alpha particles into the dermis, it generates a tiny, manageable burst of reactive oxygen species.
Okay.
This mild oxidative stress effectively triggers the body's internal alarm system. Specifically, it upregulates the NRF2 pathway.
NRF2. Okay, and what does that do?
It controls the production of endogenous antioxidants.
So the body basically overcompensates for the mild stress.
Right, by rapidly repairing cellular membranes and restoring the structural integrity of those lipid bilayers on the red blood cells.
Fascinating. And what role do the nitrogen microbubbles play in this process?
The nitrogen provides the physical shear stress. As these microbubbles continuously form and collapse against the patient's skin, they stimulate the dermal mechanoreceptors.
Like a very intense micromassage.
Exactly. This tactile stimulation triggers reflex arcs that promote the release of nitric oxide in the endothelial cells lining the blood vessels.
So we have two simultaneous mechanisms here. The physical stimulation of the nitrogen bubbles signals the blood vessels to optimize their flow,
Yes.
while the mild hormetic stress of the low-dose radiation forces the body to rapidly repair the surface structures of the red blood cells, theoretically restoring their negative electrical charge.
That is the conceptual framework, yes. But of course, the true value of this publication lies in its empirical data.
Right. We need to see the numbers.
Exactly. After completing the Balneotherapy protocol, the researchers drew blood again and measured the identical parameters to see if this dual mechanism intervention actually altered the hemorrheology.
So let's examine the post-treatment findings. Did the biological intervention actually resolve the microscopic traffic jam?
The structural shifts were highly significant.
Okay.
The ultrasonic resistance time, the metric defining the physical strength of the cell membrane, increased by 14.7%.
Wow, 14.7%.
Yeah. The erythrocytes became markedly tougher and more capable of surviving the journey through the vascular system.
And regarding the electrokinetic potential, did the cells regain their repulsive static charge?
They did. The EKP increased by an average of 2.3 millivolts.
Which represents what kind of relative increase?
That is an 18.4% relative increase from their baseline.
That's substantial.
Very.
Yeah.
Because the cellular membranes were repaired, the sialic acid residues could once again generate a robust negative electrical field.
Which logically dictates that the aggregation activity should fall, right? If the static charge is restored, the cells should immediately stop adhering to one another.
The data confirms exactly that. Aggregation activity decreased by 16.2%.
So the traffic jam cleared.
Yes, the rouleau formations broke apart. The red blood cells returned to their independent repulsive state,
allowing them to freely flow into the microcirculation and deliver oxygen directly to the hypoxic joint tissues.
Precisely.
Now, these biological markers are absolutely fascinating, but we really must translate them into clinical realities.
Of course.
Because recharging the electrokinetic potential of an erythrocyte in a laboratory assay is an impressive biophysical feat. But we have to ask if this microscopic restoration translates to measurable symptom relief for a patient suffering from chronic orthopedic pain.
And the study provides direct statistical correlation to answer that.
Okay, let's hear it.
The researchers mapped the biophysical changes against standard clinical pain indices. They discovered a statistically significant correlation, coefficient of R equals 0.42, between the increase in the electrokinetic potential and the reduction in the patient's reported pain intensity.
So an R value of 0.42, that indicates a moderate but undeniable mathematical relationship.
Right. It establishes that the reduction in pain was not merely a placebo effect of a relaxing spa environment.
The pain diminished in direct proportion to the restoration of this cellular electrical charge.
Exactly. And furthermore, the study offers a critical sub-analysis that reinforces this mechanism.
Oh, what do they find?
The researchers documented that the clinical improvements were significantly more pronounced in patients who presented with concurrent synovitis.
Active inflammation of the joint lining.
Yes.
Well, that makes perfect physiological sense, actually. A joint suffering from active synovitis has an extraordinarily high metabolic demand.
It does. It's desperate for oxygen.
Desperate for oxygen to process the inflammation and evacuate metabolic waste.
Right.
So by breaking up the cellular traffic jam and restoring microvascular flow, the intervention delivers the exact resources the most inflamed joints require to stabilize.
Exactly. And as we move toward the institutional and policy implications of this research, it seems this paper really challenges the broader medical community's perception of physical rehabilitation.
Without a doubt. Balneotherapy has frequently been marginalized in Western medicine as a supplementary wellness practice, rather than a hard clinical science.
But this publication provides the quantitative scaffolding necessary to change that perception.
Right.
It demonstrates that specific environmental modalities don't just soothe the nervous system, they actively modulate erythrocyte rheology.
When we can prove that an external intervention physically changes the deformation capability and electrical charge of a blood cell, balneotherapy transitions from complementary care to a targeted physiological intervention for vascular pathology.
It certainly prompts a system-level reflection on how we design chronic pain management.
Absolutely. Our standard institutional approach to osteoarthritis relies heavily on pharmacological pain, masking NSAIDs, corticosteroids, and eventually surgical joint replacement.
Yes, very structural and symptom-based.
Right. But this research advocates for integrating therapies that target the underlying microvascular hypoxia much earlier in the disease progression.
However, we do need to address the structural and methodological limitations of the current study.
Always important.
The authors are very transparent that this is a prospective observational study. While the findings are compelling, elevating this to standard clinical policy requires Phase 3 randomized controlled trials.
To eliminate confounding variables and establish a definitive causal hierarchy.
Correct. The researchers explicitly call for future studies that integrate molecular biomarkers and longitudinal follow-ups.
Because we need to ascertain the durability of this intervention. Right.
Exactly. How long does the restored electrokinetic potential last after the patient leaves the isothermal bath?
Does the body require maintenance sessions to keep the NRF2 antioxidant pathways active?
Right. Those are the crucial next steps for the scientific community.
But for the clinical practitioner and the academic observer, the immediate value of this deep dive lies in its redefinition of the disease itself. Osteoarthritis must be viewed through a systemic microvascular lens.
I completely agree. The health of the joint is inextricably linked to the biophysics of the blood supplying it.
It's a reminder that the human body is a deeply interconnected system. A mechanical failure in the cartilage is often the final symptom of a prolonged failure in cellular physics.
Which leaves us with a profound concept to reflect upon.
Right. If highly specific environmental exposures like low-dose ionizing radiation and the sheer stress of nitrogen microbubbles can physically reconstruct the electrical fields of our circulating blood cells to heal our joints, it raises a larger question.
What's that?
What other ambient environmental interactions, from the atmospheric pressures we live in to the trace minerals we absorb, are silently modulating our cellular physics right now without our conscious awareness?
That is a fascinating question to leave everyone with.
Thank you for listening to the GMJ podcast. For a full and detailed discussion of the topic presented in this episode, we invite you to consult the original article published in the Georgian Medical Journal. A direct link is provided in the episode description. We look forward to continuing these scholarly discussions in future episodes.